Hello and welcome to ID Talk, answers from an infectious disease expert. I'm Dr. Sean Elliott, a pediatric infectious disease specialist with Tucson Medical Center, professor emeritus of pediatrics at the University of Arizona College of Medicine, and medical director of infectious diseases and immunizations at the Arizona chapter of the American Academy of Pediatrics. This podcast has been created to answer questions from our chapter's members about the COVID-19 pandemic. This is the week of February 14th. Happy belated Valentine's Day, everyone. As it stands globally, we are up to a total cumulative caseload of 415,769, almost 770,000 cases total, with 5,800,000 and almost 40,000 deaths reported as of this morning globally. In the United States, our caseload is up to 78 million and almost 40,000, and deaths are 925,560 since the start of the pandemic. Speaking specifically about pediatric patients, this is the AAP report through February 10th, so end of last week. Caseload is up to 12.3, almost 12.4 million total cases of pediatric patients, accounting for 18.9% of the cumulative total of cases from the start. That comes out to a case rate per 100,000 pediatric patients of 16,397. Again, the telling point, as I've said in the last several podcasts, is the percentage of cases per week, since that number has been up and down significantly for pediatrics. They're actually down a little bit for the most recent reporting week, down to 21.9% of the total cases reported for the week ending in February 10th. It has been as high as 30%, and prior to this last week, the number has been a little bit closer to 25 or even 26%, so about a quarter of cases. So overall, numbers are coming down significantly, which is a good thing, both for adults and for kids. In Arizona, also our numbers are dropping, finally. Also, Arizona's placement in terms of pediatric caseload or attack rate or prevalence, if you will, is down to number 13 in the country. We have it as high as number 1, so that is fantastic news. Our cumulative caseload is 408,445 total cases since the start, which comes out to 21.1% of our total percentage, and 22,215 cases per 100,000. So overall, again, Arizona, both pediatrics and adult cases, is also finally trending down, and trending down significantly as we too start to recover from the most recent Omicron surge. Number of deaths related to or caused by COVID-19 in pediatrics since the start of the pandemic is up to 59. That is still the second place in the country, following only Texas. And again, keeping in mind, this is a cumulative number, not a rate, not a number per 100,000. So if you were to look at number of pediatric deaths related to 100,000 children population, Arizona is actually going to be even perhaps number 1. So not a good thing to be known for, but at least that number 2 has started to stabilize somewhat. So where are we at? Boy, a lot of news just in the last week, mostly due to the request for Pfizer's data by the FDA and CDC to look at vaccination safety and efficacy in children from 6 months up to 5 years of age, and then the sudden reversal on that decision just in the last couple days. And as anticipated, we have some very appropriate questions having to do with that apparent reversal. The biggest and the most important is, so this has happened, how do we communicate what has happened to our families? And especially, how do we navigate what I am certain must be both confusion and perhaps evolving distrust of the federal regulatory process when we have sort of a take backsies, as it seems to have occurred? I guess, first of all, my thoughts about what has happened. I believe I said in the last podcast that I was somewhat surprised that the FDA extended a request to Pfizer to share its data in anticipation of the emergency use authorization of that vaccine from 6 months through 4 years. In knowing that Pfizer was not yet prepared to release its data for the third dose in kids ages 2 through end of 4 years old. And yet the FDA said, yes, we recognize that. However, in the wish to move the approval process forward expeditiously and likely under significant national pressure from various lobbying organizations, we will agree to accept data from that third dose as it becomes available in sort of a rolling approval process. It does seem that Pfizer acquiesced. Of course, who wouldn't when the FDA says, hey, let's give you early authorization and increase your volume for this vaccine. However, I think Pfizer appropriately said, look, due to the Omicron surge, we're getting a wealth of data in our kids to whom we gave that third dose, and we might be able to give you a complete and total package with much more assured efficacy numbers or estimates and further confirmation of the safety of the vaccine if we can wait just a little bit. I'm not sure how that played out at the Food and Drug Administration, but clearly they decided to go that direction and to hold off on discussing approval of the vaccine. It still seems that a rolling approval process to me could have been conducted, since by the time any child for whom EUA was administered 6 months through 4 years, by any time that child was ready for their third dose, it would have been likely to have had that data in place and assessed. So clearly other things have happened that is not part of the national conversation, and certainly the various ears that I have to the ground, and others as well, has not identified any specific reasons for that. So we're sort of left to guess at what has happened, and that of course makes the explanation of what happened to our parents far more challenging. I guess what I would take out of this, however, is that at the very least we can trust our federal regulatory commissions, like the FDA and secondarily the CDC, to be first and foremost about the science, that science is important, science talks, and that perhaps there was a recognition that the request for approval was a bit overeager. And in response to that, the decision made to cool our jets, wait until we get all the data, and then look at the approval process from beginning to end. All 3 doses for those ages 2 and up to 4, and then the 2 doses for 6 months up to 2 years. Regardless, that is where we're at right now. Pfizer has publicly stated that it anticipates completing its data collection for that third dose in ages 2 through 4 years by early April. So again, pushing things off, from what we anticipated to be potentially, by March, by at least another month or so. However, by the time we do get that emergency use authorization, I imagine the Omicron surge will have further declined across the country, and B, will be able to say with good assurance that the vaccine does or does not work in that population. Again, the indications are that the Pfizer vaccine does work. It works significantly effectively. So hopefully it'll be confirmed that the third dose adds that final boost, if you will, of efficacy that we're waiting on. In terms of safety, and this I think is the other important conversation, the safety of either mRNA vaccine, whether it's Pfizer or Moderna, in all ages really has been proven to be quite excellent without major concerns, regardless of the age of the recipient. Yes, there are still both scattered reports and small case series of post-vaccine myocarditis reported with both Pfizer and Moderna vaccines in teenagers, young adults, very rarely, if at all, in kids ages 5 through 11. Not too surprising. Well, actually, it is somewhat surprising because the hyperimmune response should have the same targeting as it does in ages 12 and up. However, that being said, there are only a small number of cases in ages 5 through 11 years old with post-vaccine myocarditis that have been reported. All of them continue to be mild. All of them continue to have full recovery within weeks to no more than a month or so after vaccine. All of them are responding in terms of symptoms, the chest pain, etc., to non-steroidal anti-inflammatory drugs, especially ibuprofen products. So that the post-vaccine myocarditis itself remains mild and quite rare. Once again, comparing and contrasting the both risk of, numbers-wise, of COVID-19 associated myocarditis and the severity of said myocarditis, which are whole logs higher in both incidence and severity. It's I would hope, an easy decision and hopefully a very easy conversation to have with our parents. Other safety issues related to either mRNA vaccine in pediatric patients continue to be mild injection site tenderness, slight malaise, slight headache, slight muscle aches, all of which are resolving 24 to 48 hours, even less, after doses of the vaccine. Very interestingly, the initial estimates of those side effects from the vaccines, which were done on the placebo-controlled trials in the early days, there is now a very excellent report and evolving understanding of something called the nocebo effect, which is a person receiving a placebo medication, intervention, procedure, surgery, etc., is actually somewhat more than likely to develop any suggested symptoms which have been reported as possibly associated with the test product itself. For example, although I know in retrospect that as a Moderna vaccine trial participant that I did get Moderna vaccine, not placebo, I was a little worried there for a while when I had quite a significant reaction after my second dose of whatever it was, and was thinking, oh my goodness, if I actually got placebo, then joke's on me because I'm very suggestible to the thought that I might have low-grade fever, rigors, and severe myalgias, which is what I had. But as it turns out, under the nocebo effect, N-O-C-E-B-O, nocebo effect, exactly that situation can occur. I say that because the reporting of those side effects by people who received a placebo negatively contributed to the study outcomes, giving a falsely higher rate of adverse vaccine effects, true vaccine effects, than in likelihood actually existed. So, of course, try to explain the nocebo effect to somebody who is vaccine hesitant and has questions about safety and outcomes, because I can imagine what they might hear is, oh, the scientific process is flawed and anybody can report anything and you'll count it as real. So hopefully we all know that that's not true, but it's going to be an interesting conversation should that come up in the practice. So what do we do about potential loss of confidence of those parents with kids ages 6 months up through 4 years of age whose potential vaccine approval has now been confusingly delayed? How do we have the conversations? And I think honestly that the best approach is to sort of manage up as we speak in corporate world, saying, okay, so yes, this is disappointing. However, I believe the FDA made this decision out of an abundance of caution, knowing that this is a very at-risk patient population. The health of our littlest children, of course, is incredibly important, as is everyone else's PS. And so the FDA is making the decision to wait the full data rather than pushing a little bit too quickly. And I suppose one, depending on one's audience, could suggest that the FDA may have been pressured by external forces at the federal level in starting the approval process earlier than it wished to in the first place, and then finally was able to say, hey, hold on, this is not right. Let's wait and do the right thing, follow the scientific process, and wait for the data. So that's one way that conversation could play out. I think the other is, again, to say that by the time we do get an official emergency use authorization for that vaccine in that age group, that it will be based on the strongest, best data possible, as is deserved by our pediatric patients, and that I would feel very confident in recommending that vaccine to the youngest child down to age 6 months. Okay, so another, of course, part of that process is how do we continue to recommend COVID-19 vaccines even as we get ongoing approval process for our kids in a setting where Omicron numbers and COVID numbers are going down, both among adults and among kids as well. And certainly one could reasonably say, well, why do I need protection? Because it won't be an issue, in another couple weeks or so. Of course, kids generally don't get as sick as do adults. And by and large, that is true, but I think many, if not all of us, have had patient encounters or patient exposures where indeed, a child was very sick from COVID or complications thereof. And the mortality rate is not zero. For example. So it's hard to say, in terms of comparative numbers that kids are anywhere near as severely affected by this pandemic as have been adults, and certainly unvaccinated adults. But we also need to point out that the risk is not zero. So how much risk is somebody willing to tolerate? Also, and I think this is perhaps the far more important point, we're still, recovering from yet another variant which emerged, in fact, may have been an antigenic shift. And there's no guarantee that yet another variant and yet another major series of mutations will not occur in the foreseeable future. What is absolutely guaranteed is that SARS coronavirus 2 will, at some point, if it hasn't already, entered an endemic phase, meaning that only those who are vaccinated fully with the utmost level of protection scientifically achievable will be able to tolerate an endemic infection phase without significant risk of hospitalizations, morbidities, and mortalities. So even if not vaccinating for the current time right now, as Omicron numbers go down, it may be that the next, Greek letter coming down the pipeline may continue this process, and we would still need everyone to be vaccinated for their own safety and for the safety of the population to avoid propagating that cluster as high as the last surges have been. So personal responsibility, of course, societal responsibility, and of course personal risk, because only those, even in its current Omicron surge, who are not only vaccinated but vaccinated and boosted are the ones who when infected and sick, have been able to avoid hospitalization almost exclusively. So I think that's an important conversation to have as well with our patients or parents when they ask those questions. Next question then is, with all this said, even if cases are going down, hospitalizations and hospital capacity are still something to be concerned about. At what point are hospitals in a safer and more supported place in terms of the pandemic? Boy, I suppose one could say that we're approaching that point right now in terms of resources. And so, having come through yet another significant surge in which hospital censuses were extreme, and many hospitals were sort of running in a code purple situation with patients waiting for hospitalization in the emergency departments and running short of ventilators and etc. Those numbers, that attack rate, that prevalence has certainly dropped significantly even in the last week, so that hospitals in Arizona, in our various catchment areas, are now sort of emerging once again from the depths of despair with a huge surge, and being able to reopen the doors to elective surgeries, readmitting or being able to admit patients with diseases other than COVID related. So we're at that point right now, and even a week from now, and certainly hopefully in the next couple of days, by the time you hear this podcast, we'll be even further into that recovery phase. However, and I need to point this out, and I'm sure you're all thinking it, I hope you are, it's not just physical resources and logistical support that have been challenged every single surge. It is us as healthcare providers and our colleagues, and especially our nurses and ancillary staff and people in hospital and ED providers, etc. Every single person who's been through all these surges, even as we emerge shaking our heads from the attack of the most recent surge, has probably lost something in terms of resilience, wellness, strength, mental capacity, the whole nine yards. I mean, we are all of us fighting this battle ongoing, and after a certain point, battle fatigue is not something that one can recover from. So I guess I would argue that the healthcare industry and the healthcare infrastructure, and especially we as healthcare providers, are not an infinite resource, and it is not any time in the foreseeable future that we could count ourselves as being 100% battle ready for the next pandemic, epidemic, infection, or who knows what. So with that as an understanding, I think we just need to keep focusing as best we can on keeping ourselves fit, physically, emotionally, spiritually, etc., looking after each other, taking care of ourselves, and pinning hopes on emerging into an endemic phase where most people do well. Yes, there will always continue to be morbidity, mortality attached with this particular virus and its variants for the foreseeable future. I think that is a reality. The other reality, though, is that knowing that, we need to keep moving. We need to keep doing our thing. So there you go. Some sort of difficult topics to talk about. And I will admit to some personal frustration with the actions by the FDA, just because it makes our jobs of explaining what happened that much more difficult to our parents who quite reasonably have questions. So I hope I've given you at least a couple talking points to put in your back pockets and take forward into that next clinical encounter. Other than that, though, I think we can remain confident that the numbers will continue to decrease. The impact on pediatric health will continue to decrease as well. And as that happens, and as supply lines come through, we'll be better prepared with antiviral medications, which can be administered orally, and vaccines and other products. We should be better prepared for the eventual next surge, unless it's a sort of mild epidemic surge, or I should say endemic surge, that we can handle because most people are vaccinated. So there you go, marching orders. Take care of ourselves, take care of our patients, keep advocating for vaccines, keep advocating for pediatric research so that we get all those wonderful interventions to be tested, safety approved, and ultimately approved formally for kids younger than age 12, which is the current cutoff. So with that, thank you for listening to ID Talk. AzAAP members can submit questions for future episodes to covid@azaap.org. AzAAP would like to acknowledge the generous support of this podcast by the Arizona Department of Health Services through the Title V Maternal and Child Health Services Block Grant funding. For more information and resources related to COVID-19 in Arizona, or to learn how to become a member, please visit us at azaap.org. And once again, and in the meanwhile, hang in there, folks. Take care of yourselves. Thanks for listening.